We'll wrap up our videos by talking about some age considerations for the abdominal exam. First, in pediatrics, remember that infants, of course, have a visible umbilical cord for the first 7 to 14 days of life. Parents just need to keep it clean and dry, and it should fall off on its own. Of course, if they have any questions, they can contact us. When we listen to a young baby's abdomen, we should really only hear bowel sounds, no vascular sounds. We also need to pay special attention to those sounds because if we hear bowel sounds in the chest, then they could have what's called a diaphragmatic hernia. I'll show you a picture of that now. You can see that on the right side, the diaphragm is intact. The chest cavity looks normal. On the left side, there's actually a hole in the diaphragm, and the intestines have all moved up into the chest cavity here, and so the lung is only partially expanded. And this is a surgical emergency that needs to be corrected quickly before these intestines get blocked off or before the lung fails to form correctly. When we palpate the baby's abdomen, to actually feel a little bit of the spleen. Again, just be gentle when you're palpating that. We also specifically palpate where the umbilical cord was, because babies can develop what's called an umbilical hernia. You can see in this picture here that there's actually an open in the muscle abdominal wall here, where when the baby is crying, intestines can push through that where the umbilical cord was, and this is the umbilical hernia. We do follow them over time. Many of them will close gradually over the first year of life, but if they're not closing on their own, then we do a minor surgical procedure to close it to prevent those intestines from getting trapped and then strangulated by the muscles. Also notice that this baby appears to have a protuberant abdomen, and that is perfectly normal for a baby. We like to see those big rounded bellies, and in fact that belly should stay looking sort of rounded. Some people call it a pot belly for the first several years of life. It doesn't start to really flatten out until we hit late preschool, early school age years. For older adults, just be extra aware of your exam sequence to minimize the number of position changes, and also be aware that there's usually decreased fat deposits. So you may be able to more easily palpate structures within the abdomen. Just be careful not to misidentify normal findings, such as kidneys, as a tumor accidentally. Older adults can have decreased sensation of pain with that abdominal palpation though, so there's no need to be particularly gentle. Just gauge your patient's level of comfort. So that completes our discussion of abdominal assessment. We started by reviewing a little bit of anatomy and physiology, including making sure we know how to divide the abdomen into either 4 quadrants or those 9 regions, including the epigastric region and the umbilical region. We then discussed history questions we might ask, such as patterns related to eating or common abdominal symptoms like nausea, vomiting, diarrhea, and constipation. We also discussed referred pain and how patients may misidentify the source of their pain. From there, we moved into our physical assessment. And remember that for the abdomen, the sequence is unusual. So we still start with inspection, but then we moved to auscultation instead. And then we moved to percussion and palpation. Lastly, we finished off with some age-related changes, such as a large spleen for infants and decreased fatty deposits for older adults. If you have any questions about any of this, remember to write it down and either email me or find me after class. Thanks.